Live with Liz. Say good evening, Liz.
Hi, everybody. So, I do apologize. I made a post a little bit ago. We had the Johnson Jordan dinner tonight, virtually, of course, and it went a little bit longer than I thought it was going to be over at 8:30, so I thought we were going to be fine. I think that's the time they advertised. And it went a little longer, and then we had our technical difficulties to
Of
deal with. So let me check real quick just to make sure we are live on Facebook.
we are. Looks like we have 8 viewers.
Oh, how can
10.
you tell?
Or
Oh,
we are
okay,
rolling.
yes, I see it. Okay, so please say hi if you're watching, um, so that I know you're here. And I know the last time we went live, we had some trouble with viewing comments, at least through the program we're using. So I'm gonna try to keep an eye on the Facebook over here on my laptop to my left. Y'all can't see it. So that I can make sure we don't miss any comments. Another thing I want to say is we are live on my congressional page as well as my personal page. So I'm probably going to be looking at my congressional page. So if you want to comment, please go watch there. All right, so let's get started. Thank you for joining us. Um, I really appreciate y'all taking the time to watch and talk to us and discuss issues on Texas 8.
All right, so we are 40 days from the election. Coming up
Yikes.
fast. Um, so things are heating up. Been doing a lot of block walking, dropping literature. So Liz, how do you think the campaign's going?
Good. We are getting about 5 miles of walking in per day, so and lots of steps, which is good for our health and wellness.
That's only going to
Um,
go up.
yeah, yeah, it's been really good. We've had, volunteers reach out to us that have come and help. Thank you, Christina, for going with us today. Thank you for Stephen and Gareth for joining us this week more than once. We can't do this. We can't win this fight without volunteers. I'm just the face of this campaign. I am, willing to put myself out there to stand up for what I believe is right. But at the end of the day, we can't win this campaign on our own. And so it's super important that we have volunteers to support us, and I appreciate it so very, very much.
And it's a lot of fun. It's a lot of fun. We get a group together and we go out. And so,
Yes.
so please, I think Liz is posting every day where we are going. And so, if you'd like to join us, you are more than welcome. We can certainly use the help. We've got a lot of ground to cover. 40 days to do it. We're going to be out there every single day. Also have some other good things happening on the campaign. Very close to getting our first commercial finished. And so as soon as we get that done, we will be promoting that on social media. And we got a few more in the works. And so we'd like to get them. Obviously, we'll be promoting them through social media. We'd like to get them out on the airwaves. That does take money, and so if we get enough donations in, we plan to do that. Um, and so a lot of good things happening. So Liz, why don't you talk about some issues you wanted to address a specific issue on today's topic. What was that? Do you recall?
I can barely hear you. I'm sorry. Okay, try to ask me again.
Oh, I said you when we closed up last show on Tuesday. You said you wanted to talk about an issue on tonight's show. We do these Tuesday afternoon at 2:30. Is it 2 or 2:30, Liz?
So you're wondering what issue it was?
No, what we are doing 2 shows a week. Tuesday, and what time's our Tuesday show?
2 p.m.
Okay, 2 o'clock, and then Thursday at 8:30. And so when we closed Tuesday's show, you said you wanted to address an issue on tonight's show. Do you recall what that issue was? I think
Oh,
it was. I think it had to do with healthcare.
Honestly, I've slept since then. I mean, there's so many issues, but okay, yeah. So healthcare, we can talk about that. I think right now that's probably one of the most important issues that are affecting, all Americans. Um, my experience with healthcare, I may have said this before. Growing up, I came from a pretty large family. My dad was an independent contractor, worked for himself, small company. And so we typically didn't have health insurance. I think my mom said maybe at one small point we might have had Medicaid. But, I don't remember going to the doctor for annual visits, wellness checks, or getting my teeth cleaned every year, or, actually now it's every 6 months that they recommend. And so I kind of made a promise to myself, that when I had children, I wanted to make sure that I was able to take them to the doctor for regular wellness checks and teeth cleanings and vision screening. I have terrible eyes, by the way. Um, and of course, my kids have, well, at least one of them, the oldest, has inherited that. But so I've always had insurance. I made sure that when I looked for jobs that I worked or got hired with the company that offered the insurance. Of course, it's always awkward, when you're trying to get a job and you hear, oh, we have health insurance, but you really need the details of that insurance to find out what your salary really looks like. Because, what are the premiums going to be? How much is it going to cost to cover my whole family? And then even with that, how much are the copays going to be? How much do I have to pay for my prescriptions? How much is my deductible? And my latest employer, my deductible was about $3,000, and medications were also subject to that deductible. So pretty much, up to that $3,000, nothing was really covered. In addition to the fact that I was already paying premiums out of my paycheck, every 2 weeks. And, right now we have a lot of families that are without insurance due to the pandemic. They've lost their jobs. And I think we're seeing now more than ever the necessity to have Medicare for all, or to expand on that. Um, you shouldn't feel like if you lose your job, you're going to lose your health coverage. And employers offer Cobra, but it's very expensive. Um, Many families
Well,
can't afford to pay for that.
let's talk about all of the ramifications that go into and that having Medicare for all would do. Uh, because I'm not sure that people really think about all of the aspects how having quality medical coverage can impact. And so why don't you speak to that, since you've been there, you've been a mom, you've had to take your kids to the doctor, and also from an accounting standpoint, because I don't think that people really understand what it would do for the economy as well. And you talk about healthcare in rural areas, how just having Medicare for all would help that. So why don't you speak to that, and just to give everybody a sense of really how big of an issue this is, and how many aspects of their lives it touches.
Yeah. So talking about the rural areas, Texas 8 makes up a huge part of it is made up of rural Texas. Um, for those of you who don't know, there's 9 counties total. A few of them are portions. I believe Leon County, we have a portion of that county. We have Madisonville, San Jacinto County, Houston County, Walker, Montgomery, a portion of Harris. So all the portions that are up north are kind of rural Texas. And, hospitals um, have had a hard time staying open over there for a few reasons. They can't keep doctors on staff, and they can't, fund having the hospital open because patients don't have insurance or healthcare coverage to be able to be seen, for things like um, preventive care visits. And so I really believe that if we had more coverage, more constituents on Medicare or on an insurance plan, whatever you want to call it, health coverage, they would go to the doctor for those needs, and that would allow those hospitals, to stay afloat, to stay open. Every, area should have access to quality health care. You shouldn't have to drive an hour to the doctor, especially in an emergency situation. You can't, I mean, it's just not okay. And, obviously with the pandemic, it's obviously worse as well. So by us having that option, you're creating more of a demand, which will allow the supply to remain open. Let's see if we've got any comments. Oh, I see a comment come through. And it looks like this is through YouTube. So it's from Scott Woody. He says, "Hi Liz, please talk about the district's need for flood mitigation during hurricane season. Also, how can we improve rural internet access?" Yes, while we're talking about the rural areas, so access to quality healthcare for the rural areas is a must. Also, internet access. During the pandemic, it's a very huge problem. It's even worse because right now everybody is dependent on the internet to connect with one another while we're in somewhat of isolation. Our schools, our kids, they are suffering in the rural areas because they don't have that access. I know I've heard of a lot of schools having to set up, like a bus with a Wi-Fi router there, and the kids are having to, or their parents are having to drive them to school, and they have to sit in the car and connect to this sort of temporary Wi-Fi in the parking lot of the school so that they can do their homework. And I mean, the option is do that or send your kids back to school, and maybe you're not a parent that's ready for that. Maybe you have a child that's high risk. So it's very important that, internet access be expanded in the rural areas. Also, we can't bring businesses to the rural areas to drive the economy if they don't have access to internet. Everything is internet based now. And I mean, just as a consumer, when our internet goes down at home, we're freaking out. I mean, it's 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 impossible for businesses to thrive without that. Point of sale systems, credit card machines, they all use internet. And so businesses aren't going to want to open in those areas if they can't get, quality internet. So, that's definitely going to be something important to me when I get to Congress, fighting for that, and not just trying to get something passed and getting funding for it, because I believe our current rep possibly has done something like that. You might know the details, Nassim, but nothing has actually happened. So,
So what
flood.
about what about the question? I think it was directed to flood mitigation.
Mhm.
I know that you've attended a couple seminars in that area. Why don't you speak to what you would do to address that issue specifically for Texas 8? Because it is a
Well, I think
problem.
it's important that we actually listen to the experts, kind of like in the case of COVID. Listening to the experts, the CDC, because I'm obviously not an expert in flood, but it's my understanding, a lot of the flooding that happened um, in certain locations, at least, they did not listen to the Marine Corps, and they did a lot of, what's the word I'm looking for? Um, Not testing, but oh, what's the word I'm
Almost
looking
like
for, Nassim?
analyses or studies.
Yeah, yeah, and made recommendations, and the city chose to ignore those, um, and
Was it
then
the
the
city
people
or
living.
Congress?
I'm sorry.
Was it the city or Congress? Didn't Congress ignore the recommendations of the Army Corps of Engineers? And that
Correct.
has to change.
Correct.
And so,
So
so
it's
that's
important that we listen to that, not just do what we want, because our constituents are the ones that end up suffering. And, flooding, I mean, we were fortunate where we lived that we didn't have issues with Harvey, but there are people right now that still have not been able to get their homes restored. And that's terrible, terrible. So we definitely need to address it,
yeah.
and
Where
listen to
were
the
you the
experts.
other? You were just in an area of the district where we saw. Where was that? The Tamina area. There
Yes.
is still damage that is that's not been
Yeah,
addressed, not been cleaned up.
we
And
drove
so,
over to the Tamina area just to kind of see how things were. I know after Harvey, I had heard a lot of of things about that area and the people that were living over there. And yeah, there are still
okay.
homes that have not been rebuilt. There is a lot of
Get some milk. Okay.
trash. You can tell flood
Go.
damage that has just piled up and it hasn't been cleaned up.
Yes.
Um, so
So yeah, it's definitely an area that needs addressed. Any other comments or questions coming in, Liz?
not
Since
yet.
after
I'm wondering.
we get all the stuff made
Let me
us
check
slime,
Facebook
I
real
need
quick.
you to go in the car and get that purple thing because that's the container for the slime, okay?
One thing I do want to say
Say
while
hi.
Lila's talking to Nassim is,
The junior campaign
um,
manager. Okay, go.
Is Mom not only there?
She's there. See. Okay, go.
is
But is she the only one?
Yep.
that's my 5-year-old
A lot
Lila.
of people are watching.
She just started
So
kindergarten this year.
go.
One thing I want to say, there's a lot of issues that affect different people in different ways. And one thing about me as a person and as a candidate is I don't pretend to know everything, but I'm willing to learn
No, keep him
anything.
out. Keep him out.
So if I try, I get invited to meetings and from different organizations, and um, as a congressional candidate, there's a lot of requests for things. I mean, my schedule is pretty much stacked, every hour of the day. And I try to never turn down events where I can learn something. So if you're aware of, something that I could benefit from, learning from the experts, Scott, you, especially since you're mentioning, flood mitigation, please let me know so that I can look at that resource. And thank you for watching, Scott. I know we've interacted with you a little bit over the campaign. Does anybody else have a question? I know we've kind of talked about health insurance and, flooding, rural internet, hospitals in rural areas. Let's see if we have any comments on here. I don't see any through Facebook. So it looks like at least the YouTube one's coming through. Some people are watching, but I don't know who it is. Oh, accidentally playing. And, nope, back out of that. Sorry, guys.
All right. So, yeah, I mean, another big issue is the economy and economic policy. And so, what I think we will do is dedicate next week's shows to that. Current Representative Kevin Brady has put out some statements over the last few weeks that I think we need to address with respect to economic policy. And if any of you have questions that you would like addressed during the show, you don't have to wait till the show. You can email them to the campaign. We're always seeking comments, questions, and we will certainly address them. I think we will dedicate both shows next week, both the Tuesday show and the Thursday show, to the economy, economic policy, tax policy, and things of that sort. And of course, address any other issues that come up during the show. But anything else you want to add on that, Liz?
About what we're going to talk about next week?
Yes.
No.
All right.
No,
So
I do,
we're
yeah.
at our 9:30. I don't know if you want to keep going since we got on a little
Yeah,
late.
I figured we would stay on a little longer because we got on late. I mean, it doesn't have to be too much longer, but I mean, I can't even tell how long we've been on actually. Let me see if I have any comments on my main page. Is there anything anybody wants to know about me that y'all don't know about me?
Let me just comment. Um, like I said, we are 40 days from the election. Just being out, hitting the pavement, um, you know, dropping literature, talking to voters. Um, Personally, I love the energy. Um, People are very excited. Democrats are fired up. Um, and so, I don't, I've never really been one, especially lately, to look at polls. You can get a lot more information, get a sense of where things are, just being out in the street, interacting with voters, and they are excited. Um, I think people are ready for change. I think they're tired of,
Yeah,
the.
so
Go ahead.
talking about, our talking to voters while we're out and about, I kind of want to talk about Jude Paul that we ran into today. I would really like to hear from our audience because, I mean, that's,
Like I said, we are
sorry,
40
hold
days
on.
from the election.
Stop.
Just being.
I'm trying to see our comments and it's playing on my laptop. Because I really want to hear from the people. Okay, I put that in. About healthcare. So we met a man today named Jude Paul, or Jude, but I think he said he goes by Paul. And he was outside in his car, and we're not necessarily talking to people, we're knocking on doors, but if somebody's outside, I'm not going to be rude and ignore them and just bypass them and go to their door. So, I obviously, say good morning and, let them know that we're sharing voters information. And, I never know where they are. I mean, I don't judge anybody. And so the first thing he asked me was, well, he looked at the flyer and he said, "Are you for Medicare for all?" Or did he ask if I was for Bernie? That's what it was. "Are you for Bernie?" And I'm like, well, I wouldn't say I'm that far, but he said, "Are you supporting Medicare for all?" And I'm like, well, our position has been that we support Medicare for all with a public option. And he kind of got a little bit, not upset, but like kind of wanted to just shut down because, he feels very strongly about the Medicare for all and nothing, not a version of that. He's very involved in the union, and feels that Medicare for all is the way to go. And, I'm not, I want to hear from people. I'm really curious what y'all think and how y'all really feel about it. My position for having a public option is in part, I know when the ACA was passed, a lot of people were upset because, they were now being forced to buy insurance or getting fined. And it's been my experience that people don't really like being told what they have to do. And so, I mean, I think at the end of the day, if you have a public option, those rates are going to be more affordable and you're going to still have great access to healthcare providers. If you're staying with your private option, you're basically paying the CEOs of those large corporations their big fat salaries, and overhead for your Blue Cross Blue Shields and your Uniteds and all their advertising and marketing. And it's everything's, a lot more expensive than it should be. Lila has a wig on. And so
Let me show her my hair.
she saw.
Our position before the pandemic was I support Medicare for all with a public option for some of those reasons. I think incremental changes is sometimes a necessary step. It's sometimes difficult to go from one, place to another, a drastic, completely different change. And so prior to the pandemic, I was for the public option, private option. You choose if you want to keep paying your high premiums and stay at your employer's coverage, great. But everyone else that wants to is entitled to healthcare through the public option. And so, but I think we're kind of in a different place than we were before the primary election. I mean, would you not agree, Naseem?
I do.
I mean, I don't want to be the only one talking here. Um, I just think we are because, as I mentioned early on when we were talking about healthcare, there are people in non-healthcare situations or no healthcare right now that have never been in that situation. We don't know when the next pandemic's going to strike, and do we really want to relive the horror of losing your job and millions of people losing health insurance because they are no longer employed by their full-time employer? So I think it's really brought to light the necessity of having Medicare for all. So anyway, if you have any comments on that or opinions or feedback, I would really like to hear them. At the end of the day, I'm here to represent people, and I want to do what's best for the people of Texas 8. And right now I'm feeling a little bit like Medicare for all is more necessary than it ever has been before.
Yeah,
So
along those lines. I mean, one thing about Liz and her campaign, ever since she got into the race, is she wants to be a representative who will be accessible to the people. And so she has ideas for what she wants to do now. Those ideas may or may not change. She may have new ideas once she gets to Congress, but the point being that she will always be accessible to the people when she's in Washington. You can see what she's doing. You can see the efforts she's making to meet her goals that she's promised, and she's always receptive to new ideas. And so that's what's really going to make her a representative for the people. But it is getting a little late, and so.
but we have some more questions. Well, two more.
Okay.
So Scott Woody says, any plans to debate Kevin Brady? If you could put the debates on YouTube, that would be great. Thanks for all that you do. So Scott.
Yeah, let me
Go ahead,
address
Naseem.
that from So we have challenged Kevin Brady to a debate on social media. I think on Facebook and on Twitter. No response. I believe that the student Democrats at Sam Houston State University have also inquired about a debate with Kevin Brady. They've reached out to us. Liz has said yes, she will do it anytime, anywhere. I believe they intend. They may have already reached out to Kevin Brady, but they are trying to get something set up. And so, if they're able to do it, absolutely, Liz will be there. There may have been another school actually that wanted to set something up as well. So, yes. We would love to get that set up, but I think we are just waiting to hear back from the response from Kevin Brady's campaign.
Hasn't the GOP issued a letter about debates? All debates?
I did hear that. I heard that that the GOP from the top instructed all congressional candidates, I believe it was Senate and House of Representatives, not to debate. Now, the representatives, senators are free to take or not take that advice, and so I think to serve the constituents, I think it would be well served for them to agree to a debate. But yes, that is a good point. But yeah, great question. But yeah, Liz stands ready, willing, able to debate Kevin Brady anytime, and so we would love to see that.
Yeah, we're not expecting a lot of response to that request. I'm just trying to make that apparent.
Any other
Um,
questions?
yeah, Jeffrey Mendillo, I'm not sure how he pronounces it. I have not spoke to you before, but thank you for coming on and asking your question. He says, can you talk about your plan to represent LGBT people in Congress? In Congress is, what my plans are, and specifically how you plan to represent them in Texas 8. So, one piece that I think probably falls under that, which I have talked about in a couple of different areas, is related to civil rights. Am I on the right track, Nassim? Yes. Okay. Just want to make sure. Because civil rights is for a lot of people. So one of the things we've talked about is giving the EEOC more power. I thought we did talk about this last week, but I mean, he may not have been watching, so I'm completely fine with talking about it now. But um, so in the EEOC, if you are discriminated against, so say in this case for being LGBTQ, um, you can file a complaint with the EEOC for discrimination, and they will perform some type of investigation. And at the end of the day, and you can quote me on the statistics, Nassim, the percentage that they actually do something else other than tell you you have the right to sue. What is that number?
Uh, the last statistic I saw was around 5% of the cases they
Okay.
actually find discrimination occurred, and the other 95% they just close the case and issue the complainant a right to sue.
And what happens when you get the 5%? What do they do?
Well, this goes back to your point about giving the EEOC more power and putting them on the same footing as OSHA. The EEOC has no power. They can, even if they find discrimination, the EEOC has no power to force the company to take any corrective action. It has no power to fine the company.
So you probably still sue. You just get a letter that says you can sue and we also find discrimination, basically.
Yes.
So, it puts the burden on you, the victim, to hire a lawyer, wait months, years, months. That's hilarious because it doesn't take months, years to get some kind of justice. Um, and it's unacceptable. So yes, talking about the EEOC not really having any power, that needs to be changed because the fact that they really can't do anything and you then have to go through the whole judicial system, which, talking about judicial system, I think the judicial races do not get enough attention. I actually was on a meeting last night with the Woodlands Democratic Club, and all the judges that are up on the Democratic slate were on talking, and it's we have an amazing slate of women that are running. Please make sure when you vote that you vote all the way down ballot. It is super important because people don't realize how much the courts affect their lives until they are in court. And, in the case of talking about caps right now, if you go to court, you wait your years, you try to mediate, nothing gets resolved, and the jury finds in favor of you, you have a $300,000 cap on non-economic damages. I mean, and Nassim is a employment civil rights attorney. He's been practicing that for 20-ish years, and so he definitely knows a lot about this. But you're limited to that $300,000, and you may have gone through all kinds of anguish, suffering, and who knows what. And $300,000 is not going to deter a company. It's wrong for anybody to discriminate against you for, an LGBTQ issue. So that's a civil rights, something that I want to fight for. Something people don't really realize. It's not one of those big issues people talk about, and people don't really recognize the importance until they're they're in that situation. So again, please, look up your judges that are running this campaign season. Make sure you vote for every Democrat up and down the ballot. It is super, super important. You want judges on the bench that are going to be fair and look at the law in the way that is good for the people. So anyhow, that is one thing that equality for all at the end of the day, regardless of your race, your sexual orientation, and being involved with those groups. I mean, I definitely want to hear from that community if there are things that I'm not aware of, because as I've mentioned before, I don't know everything. I know before, and Nazim, you'll remember because you went with me, we went to visit Pause Impact, a radio station out in Houston, and they bring awareness to the HIV community. And when we were there, we were talking to them about, funding that had been cut for, I forgot what the program is called. And Jeffrey, you may know the name of it. But ensuring that community has that funding so that they're able to get the testing and the medications that they need, which, getting Medicare for all would pretty much fix that. But, that group should not be singled out whatsoever. Oh, my computer's acting up. So, Jeffrey, thank you for your question.
Yeah, let me just follow up on that. So the Equality Act was one of the bills that the latest House passed in 2018 when the Democrats retook the House. That's one of the things that they worked on. And they passed the Equality Act. And so that has passed the House. It is now sitting, along with about 400 or 500 other bills, on Mitch McConnell's desk. He is blocking it from even being heard on the Senate floor. And the Equality Act would federally protect LGBTQ in employment, housing, education, and so that's very important. And so one of the reasons why it is absolutely critical that we take back the Senate, that the Democrats take back the Senate this time. And really we need the Senate by 60 because we know that the filibusters are coming. And so if we want to get progress, like the Democrats got the Affordable Care Act passed, that they did that when we had 60 in the Senate, and people may not remember that, and that's why it was really pushed through very quickly because we knew we weren't going to have 60 for long based on some resignations and appointments that were going to be made, and so if we want the Equality Act to become law, so we need to recapture the Senate. We need to recapture the White House, and we need to keep the House. We can't lose sight of that. It is certainly no guarantee that we are going to keep the House.
We must elect MJ Hager.
That's why every House seat matters. And so to make sure that these things, we keep pushing for these things and they become law, we need to vote blue in the House, in the Senate, in the White House. And so that's very important. And the Equality Act and LGBTQ rights are a very good example of that. And so, great question. And so, yeah. I mean, we can, we can take the White House, but if we don't get the Senate, nothing's going to change. I mean, you remember what happened after we got the Affordable Care Act passed? And then Mitch McConnell just blocked nearly every single thing that Obama wanted to do past that. And then they complained that Obama didn't get enough done. Very nice trick. And so yes. So Liz, I don't know if there are any other questions or we should
I don't know. I see some on Facebook. So Bob, I don't know if you're still listening. You are watching my live stream on my personal page. And if you're watching my live stream on my personal page, the comments don't come through here for some reason. So, but I am seeing them over here. So that's how I saw them. But Bob just asked if we responded to the impact. Yes, we did. Like maybe a week and a half ago. I'm not sure when that issue's coming out. I know
Should be
they
soon.
completed that for the primary. And so yeah, it should be, I would guess sometime in October. They'll get that published. But yes, they did send us a request and we did respond. Um, and then Bob, I'm not seeing anything else, but I feel like there are some more comments I'm not seeing. I think that's it for now. I really apologize if I'm not seeing something that you're sending to me. Well,
Well,
at least our feed didn't cut out like Tuesday. I
yeah.
mean, that's progress.
Well, thank you all for tuning in again. Tuesday afternoons at 2 o'clock, Thursday evenings at 8:30 for roughly an hour. Sometimes we'll go more if people are watching and we have questions. So thank you everybody for tuning in. Liz, you want to sign us out so we can get some things
Yeah,
together?
I did just want to say at least this is recorded live. It will stay on Facebook. So if you're not able to join us at 2 o'clock or 8:30, you can always go back and rewatch it. Please share it with your friends and family. The biggest thing that we are fighting against right now is getting the name out for the campaign and letting everyone know that we are here and that people have an option. Your vote is your voice for sure. And it's always very important to vote, but now more than ever. You know, we thought that 2016 was the election of our lifetime, and 2020 has proven otherwise. So please get out and vote. Please message me or contact me. My website is shown on this screen, liz4texas8.com. If you go to my website, you can easily email me or call me, text me. I'm a texter. Again, Naseem has mentioned I want to be accessible to the people, and I have every intention of standing by that. So, but please share the campaign with your friends and family. It's super important. And right now with the COVID situation, you know, we're making literature drops as much as we can. But you know, social media is a great ally for us right now with the current pandemic that's going on. So thank you again for watching. And I'm just going to put it out there. We'll be having obviously our next show on Tuesday at 2 o'clock. If anybody would like to email me questions ahead of time, um, and then I will come on here and read the questions and answer them live. I like the idea of doing this live because it lets people just ask me questions on the fly. But if y'all would like to email me questions, I can make sure that I have, you know, several of them ready and we have a productive conversation talking about the things that you want to talk about. So, thank you. Have a good night. I'm going to go make sure my children are in bed. And oh my gosh, it's 10 o'clock. They better be in bed and eat because I don't think I've had dinner. Thank you, everyone.